This online presentation is going to involve pharmacodynamics and pharmacokinetics. So what we're going to be looking at as a part of this discussion is kind of examining the effects that both drugs have on the body and that the body has on drugs. We're going to be looking at both of these issues as we kind of go through this, looking at a lot of the physiology behind it. Again, very important that you look at and have read the chapter, the corresponding chapter in the text on this topic. So to start with, we're going to introduce the idea of pharmacodynamics. So pharmacodynamics look at the effects of a drug on the body. So in other words, when an individual takes some sort of medication, what that medication does as far as its interaction with the body. The way most drugs typically work is that they bind to a receptor. And what you look at really here is a simple lock and key relationship where the drug molecules match up with a receptor on the cell, and then based upon that either produce some type of reaction or in some instances actually inhibit reactions based upon what the individual drug is supposed to do. So there are specialized receptors on the cells, and there's also receptors as a part of the circulating proteins in the body. So depending upon what type of effects are going to have to take place with the drug, that will be the type of receptor that they bind to. And there's a real simple figure in your text on page 19 looking at the lock and key relationship. Now, we said most drugs bind to receptors. Not all drugs do. And a simple example of that are your antacids, like your Tums, Rolaids, those sorts of things. They don't bind to receptors. They just have a local, and I'll use the antacids as an example. They basically react when you take an antacid. They react in the stomach with the acid that's present. So there's not a receptor action for that type of drug. So looking further at this, at the pharmacodynamics, we have two different types of reactions that could occur. You have, first of all, what's called an agonist. An agonist drug is a drug that, when it's introduced, actually produces a pharmacological response. So what you have with an agonist are the dynamics of both affinity and efficacy. So affinity is the force that causes two agents to bind or unite. So agonist drugs have affinity and they also have efficacy, meaning that they actually produce a response. And the way they actually measure the response is through what's called a dose-response curve. Okay, so refer to figure 2.2 in your text on what's called the dose-response curve. And we'll mention this a little bit later on when we talk about dosing. Now, there are some drugs that interact with receptors but don't produce a response, or they actually prevent the effect of an agonist. Those drugs are known as antagonists. Now, what's unique about antagonists is they have affinity, so meaning they are able to bind to a receptor, but they don't have efficacy because they do not produce a response. So agonists produce a response, antagonists don't. And as we see and we go and talk about different types of drugs, you will see different agonist and antagonist drugs, just depending upon what the main effect of the drugs is going to produce. Now, some concepts with dosing. You have some different things that need to be considered. You have what you have with a lot of drugs is what's known as a standard dose. That's the appropriate dose for all adults, regardless of body size. So for all adult patients, there's typical standard doses of different types of drugs. What you also have is what's known as a threshold. The threshold is the lowest dose capable of producing a perceived response. Okay, now that's going to vary depending upon some of the different properties of the drug. So that's something that's going to have to be considered when you look at a lot of the dosing. So we mentioned how the standard dose is appropriate for all adults regardless of body size. When you look at pediatric doses, so corresponding pediatric doses for younger children, you have a lot to consider. You have to look at the age, the body weight, and the surface area of the child when you're looking at dosing. And for many medications, there are actually weight and age charts that younger children will utilize for certain drugs. Take, for instance, ibuprofen. Okay, a common drug that a lot of people use. Children won't use the standard dose for ibuprofen that you see with adults. There'll actually be height and weight charts that will dictate dosing for younger children. And just a discussion question point that I will have posted in the discussion area. What are some potential issues with elderly patients? So, when we look at adults, obviously younger, healthy adults, their bodies will react to a drug, but what are some potential issues that we look at with older patients? So take a look at that in your text and get some ideas for that to add into the discussion area.